It's my absolute honour to be CEO of Melanoma Focus. I've been CEO for about 5 years, and it's been, what a journey it's been. And I just want to have this opportunity to tell you a little bit about the charity. But before I do that, I just want to do some thank yous. So firstly, thank you for Imogen. It's always wonderful working with Imogen on this conference and taking it forward. And Imogen is a trustee of Melanoma Focus. Also, this is never one person, and this is thanks to the Melanoma Focus team. And Zoe's just started with us in January, so she's really sort of stepped up and just trying to help with this conference as our events manager. And Olivia, who's here from Meet Events, and as well as Liana in India, have been helping. But the whole team are here because we just love getting involved in this conference. Clearly, thank you to all the speakers and the sponsors and grant givers who have supported us and with the goodie bags as well. And also a special mention for Kevin Donaghy, who you'll see outside with his book, Stories of Cancer and Hope. And I've just left one of the quotes up there from one of the patients. So a little bit about the charity. So we have 3 pillars. We support healthcare professionals, and that's with education. We put on 2 conferences for healthcare professionals each year, and these are accredited conferences. We support new treatment approvals. So when I say we're supporting healthcare professionals, this obviously supports you as well, and that's through NICE, SMC, and within Wales as well. We fund research for patient and public benefit. We create guidelines, in particular rare melanoma guidelines, and we have a lot of resources as well. And then I'm going to talk through what we do to support patients. Clearly, this is one of the big events that we do, we feel really passionate about, and our awareness and advocacy work. So one thing that we've been doing with healthcare professionals to support you is trying to get access to neoadjuvant treatment. So just to explain a little bit about this, because I just felt we should understand as a melanoma community. So for those of you with stage 2B or C or stage 3 melanoma, adjuvant treatment is a treatment option where extra therapy is given after surgical removal of cancer. But there might be invisible cells remaining. And so adjuvant therapy can increase your chance of cure after surgery. So neoadjuvant treatment, for those who aren't aware of it, 2 studies have shown that giving 2 or 3 doses of immunotherapy before surgery improves outcomes compared to adjuvant therapy. And it's for stage 3 patients with operable disease spread. And also some stage 4 patients who might be offered it. It's been approved in Scotland and Northern Ireland and a near approval in Wales, but it's not approved in England yet. And so I just wanted to let you know we're continuing to work with it's been about 14 months actually trying to get this through so far, but we're continuing to work with healthcare professionals and the melanoma community to ensure that there's access for patients. Patient information. So Ross last night spoke about knowledge. I'm absolutely obsessed with high quality information and ensuring that patients, when they Google, they get accurate information. So I'm really pleased that all our information on our website is accredited. And so we go through an annual PIFTIC accreditation. And these are the areas that we need to pass. And we did survey last year, and 89% scored our website 8 out of 10, and 98% scored it at least 7 out of 10. A lot of our patient information is wrapped up in what's called the Melanoma Stages and Treatment Patient Guide. And there are various sections where you can just search the website to find that information. But this is just to give you an idea of what information is available. The Melanoma Trial Finder, this is a really key resource for patients. And I've heard from patients that during that moment of scanxiety, when you're waiting for your results of a scan, they empower themselves by seeing what trials are available so that they're aware, based on what scan results they may get, to discuss with their medical teams. So we've got a lay version of the Trial Finder that is there for you. the patient review of these Trial Finder, what we put on the Trial Finder is really critical. So if you want to help and you don't need any knowledge because it's there to make sure everybody understands, please get in touch with us. We've got a helpline that's run by 8 incredible, really experienced melanoma nurse, skin cancer nurse specialists who also treat rare melanomas as well. And we've surveyed and 100% would recommend the helpline to friends and family. So that's always there and available for anyone with a concern or a worry about melanoma. And there's some quotes that we've had. We've just piloted a coaching course with Dr. Suze Meller, who spoke last year at the patient conference. She's a GP, she's a coach, she's living beyond a stage 4 melanoma diagnosis. And we've just piloted a course that was run in January. If anyone's been on the course actually here, please come and see me afterwards because it'd be great to have a chat with you. It's for people, at the moment, it's for people living beyond an advanced cancer diagnosis. And we're going to just stick to that group because I think they've got very specific needs about living beyond an advanced melanoma diagnosis. The next course will be from the 22nd of April, and we're going to do this one in the evening. So the last one was at lunchtime, the next one's going to be in the evening. So hopefully it will give other people who might have work commitments an opportunity to attend. Is it an online course? It's an online course, thank you. Guidelines. So thank you for those yesterday who gave some really great advice of looking at the immunotherapy skin side effect guide, the patient information. So that's really helpful. So we've been working with a group, a wide-ranging group, to create guidelines. And these are for anyone, well, clinicians, nurses, so medical teams, but also patients, for anyone who's had immunotherapy treatment. And then just want to say that our mucosal guidelines, and Danielle's here, who also supports the Trial Finder. So that's very near complete, is the update of those guidelines. There's lots of posters outside. Help yourselves. We brought a selection here for you to take home with you. There's elastic bands, so hopefully it won't be too much trouble. Please help yourselves. So we've got a whole collection, and they're also downloadable from our website. Oops. And we've got some supporting the agricultural industries as well. And here's a couple of snaps that I can't resist from our some awareness activities last year, thanks to a couple of incredible patients as well, Shona and Ben. I wanted to take this opportunity as well, just to inform you, because the National Cancer Plan in England was published in February. So thank you to Mia, who will be joining us a bit later, who helped put some of these slides together and has worked really hard trying to get some activities and some mention about UV within the cancer plan, so within the prevention side. So it's a 10-year plan, and it covers prevention, diagnosis, treatment, research, and support. It's an ambitious plan, which is what you want, and they've set aside that 3 in every 4 people diagnosed with cancer by 2035 will be cancer-free. And there are other targets of performance. So as I said, we've been heavily involved in advising about prevention. And so excessive UV exposure is recognised as a key risk factor. In fact, overexposure to UV radiation is the 3rd highest preventable cause of cancer. So the plan is looking at tackling sunbeds, but it's not currently looking at other areas. And the government has commissioned a Kamari report, which should be coming out later this year, probably the middle of this year. So we'll find out more. At the moment, they're talking about clamping down of under 18s using sunbeds, but we think there's going to be more activity in this area. And there will be some work with on other prevention because the Cancer Alliances have the opportunity to work with them. It's the first time that rare and less common cancers have had a whole chapter within the cancer plan. And so this is really important for mucosal and uveal melanomas. And it's really about improving survival of rare cancers, and that's a real formal ambition. There's going to be a national clinical lead for rare cancers to be appointed, so that's a first. And at the same time, there's been a rare cancers bill, and it's just passed its third reading in the House of Lords. So that's really incentivising research and investment in the treatment of rare cancers. There's also a focus about personalised care. And there's going to be neighbourhood leads, which will be a new thing. And there's going to be end of treatment summaries and a digital first prehabilitation. So where do you come in, and how can you help us as well? So May is Melanoma Awareness Month. We've got a survey that will be going out. So this is a national survey that we've commissioned, so we're not doing it. But we probably will be having a story about sunbeds. So if you've used a sunbed, please come forward, get in touch with us, because we can provide the facts, but you provide the heart and the story. People will listen to other people's stories. Someone did come forward, when we asked recently for a story for when the cancer plan came out, and they said, please don't judge me. And it really upset me, because no one is going to judge you. But we can, as I said, we can provide the facts. So we are looking for, as well, males, because we struggle to find males who have used sunbeds to come forward. And the other thing is, if another area is if you've any males with melanomas of the head and neck, it'd be great to hear from you as well. But if you're just interested in telling your story during Melanoma Awareness Month, thank you. Please get in touch with us. And of course, support us so we can support you, whether you're interested in a skydive, running, a bake sale. Fiona's outside and she can talk you through and we'll support you with anything. And we're also doing a joint fundraiser with Skin, 100 miles in May, coming up. And thank you very much. I hope you enjoy the day.